The Executive Secretary, National Commission for Persons with Disabilities, Dr. James David Lalu, has disclosed that the Commission is committed to provide free medical services for people with disabilities in Nigeria, in line with the mandate of the Commission and the administration of President Bola Ahmed Tinubu. Dr. James David Lalu read this out while speaking to journalists in Abuja at the launching of the Telemedicine, a free medical outreach for persons with disabilities and orphans, organized by Soteria Africa Rural Healthcare Initiatives in collaboration with Poverty and Disability Initiatives of Nigeria (PADIN), supported by the Commission, which kick-started in Disability Colony Karmajiji in FCT. Said the free medical outreach is targeted to strengthen the healthcare delivery for persons with disabilities, as the organization is providing medical intervention or free surgery under the few days, noting that the Commission is providing all necessary budgetary support and logistics to accomplish the purpose, as the project will be extended to the 36 states of the Federation.
Their willingness and interest to contribute their quota in providing access to free healthcare services for persons with disabilities in Nigeria, it truly falls exactly within the mandate of the National Commission for Persons with Disabilities. Therefore, we have no any other alternative than to make sure that we collaborate strongly together with them to make sure that this program kickstart here in Nigeria, especially from the beginning. We are starting here at the Karoma GG, covering the FCT. This organization is providing total free healthcare services. It starts from provision of medical intervention as well as surgery and other things that will undergo within the few days that they will be here to provide these services. And based on their commitment, their interest is to make sure that these services are provided to cover the 36 states of the Federation. The National Commission for Persons with Disabilities will make all the necessary logistic support and budgetary provisions to ensure that we work together with them to make sure that we provide this access to services for the disability community in the 36 states of the Federation.
Medical personnel from the medical outreach speaks on the agenda of the free medical exercise.
From consultation to tests, to seeing the doctor, to medicine, to operation, they are all given for free in the community where the person is. Because some people, when you say they should go to hospital, even the money to go to hospital is not available. So we found it very good that we partnered with PADIN because they were thinking to establish telemedicine. This outreach is a prelude to a hospital that we intend to establish in their midst here for free, absolutely free. And what we are going to provide in this outreach is all the things that we have enumerated, all for free so far.
What we are doing here is basically free medical outreach. We decided to reach out to Karmajiji disability community because it's a community that is very dear to us. The founder of PADIN also happens to be somebody living with disability. So this community has a special place in his heart. You know, previously, if you can look at our banner, you will see that we have reached out to this community before. We have distributed crutches before, walking aid. We have given them food countless number of times. But this time around, we felt, okay, the malaria endemic is too much. That the best we can actually do right now, we are in the rainy season, is to bring malaria treatments to them. You know, if you look around very well, you see that the patients here are being tested. They are being tested for malaria. They are being consulted, and then they are also being treated. Also, there is also a plan for mosquito-treated nets to be distributed to them. Now, apart from this malaria, there are other things too. The telemedicine. We are bringing telemedicine into this mix also. It's a special kind of medicine that is not very, very common.
In the area of accessing healthcare. And so we came up with the pet project, telemedicine, to bring telemedicine, whereby these people can communicate with their doctors, with their medical personnel in the privacy of their community. They don't have to travel that far to go to the hospital, but they can it's just a phone call away, and they have a presence with their doctor. That's the whole idea of telemedicine.
The telemedicine is targeted to bring free healthcare services to the doorstep of people with disabilities, as they'll be receiving free malaria treatment, free surgery on cataract, appendicitis, among others, with at least 1,000 people with disabilities and the less privileged in Karamajiji.